If I were told I could only keep 3 supplements for the rest of my life as a cardiologist, it wouldn't be a tough choice, because after treating thousands of patients and performing hundreds of heart stent procedures, I've seen firsthand what works and what's just hype. Today, I'm revealing the top 3 evidence-based supplements that I recommend and would never stop using for heart health. If you or your loved ones care about living longer with a strong, healthy heart, this could be one of the most important videos you'll ever watch. Let's face it, the modern lifestyle is not kind to your heart. High-sodium diets, sedentary behavior, chronic stress, and let's not forget, genetic predisposition. Even when we eat well and stay active, certain nutritional gaps and metabolic stressors remain. That's where the right supplements come in, not as a substitute for a healthy lifestyle, but as powerful supportive tools backed by clinical evidence. Now, let's dive into the first supplement. Omega-3 fatty acids, the anti-inflammatory powerhouse. If you could only take one supplement for your heart, let it be omega-3 fatty acids. Derived from fatty fish like salmon and mackerel, omega-3s, especially EPA and DHA, are potent inflammation fighters. A 2020 meta-analysis in the Journal of the American Heart Association found that high-dose EPA reduced the risk of cardiovascular events by 25%. Here's what omega-3s do. Lower triglycerides by 15 to 30%. Improve endothelial function, the lining of your blood vessels. Reduce plaque buildup in arteries. Help stabilize heart rhythm, reducing the risk of sudden cardiac death. Omega-3s are so effective that a prescription version, icosapent ethyl, is FDA approved under the brand name Vascepa for patients with high triglycerides and known heart disease. Aim for 1,000 to 2,000 milligrams per day of combined EPA and DHA. Always choose a pharmaceutical-grade, third-party tested fish oil. I've personally seen patients who added omega-3s to their regimen and showed noticeable improvement in their lipid profiles and blood pressure within 8 to 12 weeks. Magnesium, the forgotten mineral. Next up is something most people overlook, magnesium. Despite being essential for over 300 biochemical reactions in the body, magnesium deficiency is shockingly common, especially among older adults and people on diuretics, proton pump inhibitors, or high-carb diets. According to a 2018 study published in Nutrients, nearly 50% of adults in the U.S. don't meet the daily recommended intake. So why is this mineral so crucial for the heart? Magnesium plays a critical role in maintaining normal heart rhythm, regulating blood pressure, relaxing blood vessels, reducing muscle cramps, and supports insulin sensitivity and glucose control. Here's what's fascinating. A 2021 cohort study in hypertension found that individuals with higher magnesium intake had a significantly lower risk of sudden cardiac death. For the best form of magnesium, look for magnesium glycinate or magnesium citrate for better absorption and fewer digestive side effects. The recommended dosage is 200 to 400 milligrams per day, depending on your diet and medical history. I once had a patient with unexplained palpitations. Blood tests revealed low magnesium. Within weeks of supplementation, the symptoms improved dramatically. CoQ10, fuel for the heart muscle. Now on to the third, and possibly the most underrated, Coenzyme Q10, or CoQ10. CoQ10 is a fat-soluble antioxidant found in every cell of your body, but especially concentrated in your heart. Why? because your heart never stops working, and it requires enormous energy. CoQ10 is essential for mitochondrial ATP production. In other words, it keeps your heart cells energized. But here's the catch. CoQ10 levels decline with age, and they are significantly depleted by statin medications, which millions of heart patients are prescribed. According to the European Journal of Pharmacology, statin users have up to a 40% drop in CoQ10 levels. A 2022 review in Frontiers in Cardiovascular Medicine found that CoQ10 supplementation improved endothelial function, reduced oxidative stress, enhanced cardiac output in patients with heart failure, lowered blood pressure modestly. It even shows promise in reducing inflammation markers like CRP and IL-6. Start with 100 to 200 milligrams daily of ubiquinol, the active form of CoQ10, especially if you're over 50, or on statins. When I prescribe statins, I always recommend CoQ10 alongside. Not only does it reduce side effects like fatigue and muscle pain, but it also enhances cardiac performance. How to use these three together. So, how do these three powerhouse supplements work together? Think of omega-3s as the heart's protector, reducing inflammation and clearing out bad fats. Magnesium is the regulator, ensuring smooth rhythm and relaxed arteries. And CoQ10 is the fuel, giving your heart the energy to beat over 100,000 times a day. Together, they form a synergistic trio that tackles the root causes of heart disease: inflammation, oxidative stress, energy depletion, and vascular stiffness. When to take these supplements? Omega-3s. With meals, preferably lunch or dinner. Magnesium is better taken in the evening because it supports relaxation and sleep. And CoQ10, morning or midday with food containing fat for absorption. Who should consider these supplements? These supplements are generally safe, but especially useful for people over 50, those with high blood pressure or cholesterol, anyone with a family history of heart disease, patients on statins, and people dealing with fatigue, brain fog, or heart palpitations. But always check with your doctor before starting any new supplement, especially if you're on medication or have kidney issues. In over 20 years of cardiac practice, I've seen a lot of fads come and go. But these three supplements, omega-3s, magnesium, and CoQ10, have stood the test of time, research, and real-world results. They're not magic pills, but when used alongside a healthy lifestyle, they could be one of the smartest investments you make for your heart. Take charge of your heart health. Your future self will thank you. If you found this video helpful, please give it a like, share it with someone you care about, and don't forget to subscribe for more heart-smart content every week.